It's good to have you join us on AD4TVRADIO News Update, coming to you live from Abuja, Nigeria's federal capital. I am Merciful Ajinomo. The Minister of Nigeria's Federal Capital Territory, Muhammad Musa Bello, this Wednesday said that 9 of the capital's coronavirus patients have been discharged, bringing the total recovered patients to 20. Out of the 9 recently discharged, 2 were treated at the National Hospital Isolation and Treatment Center, while the other 7 were treated at the University of Abuja Teaching Hospital Isolation Center, Gwagwalada, Abuja, Nigeria. The minister, however, urged Abuja residents to adhere to all safety measures. The federal government of Nigeria says people with over 5,000 naira in their bank account will not benefit from the palliatives to cushion the effect of the lockdown as a result of the coronavirus pandemic. The government also said that it will be using the mobile telephone networks to identify people who top up the credit units of their phones with 100 naira or less. In addition to this, the state government will now be involved in the distribution of food items. You're watching AD4TVRADIO News Update, coming to you live from Abuja, Nigeria's federal capital. We'll go on a short break now. More stories when we return. Do stay.
Coronavirus, they really make you do what you fit today, can't wait. Now the cocoa thing when you owe yourself be that because it's better to survive than for water to run your eyes. Oya waka boom boom begin the use hand sanitizer, special mask, and not grip for gun body at all for anywhere, especially where people boku, clear road, arrange yourself, keep social distance and practice good hygiene for house and surroundings. Do what the government tell you, sit down for house and make it for no loss. Coronavirus dey, so make we greet together, waka fighter like a Kozuna.
I'm appeal to Nigerians is that please, let's obey the social distancing. Let us obey the personal hygiene. Wash your hands. Don't go into congregation, and within 2 weeks, you go back and resume your normal life. If we don't do the right thing, we are going to face a disaster that we will not be able to handle.
This message now from the news agency of Nigeria, NAN. They can't pay.
Welcome back. Still on COVID-19, thousands of residents in Sapele, Delta State, Nigeria this Wednesday took to the streets in protest, demanding a reversal to Governor Ifeanyi Okowa's extension of the lockdown in the state. The governor had made a broadcast to residents of the state announcing the extension of a 14-day lockdown which began on April 1st for another 2 weeks and imposing a dusk till dawn curfew. As early as 7:30 a.m. this morning, in defiance of the order, women in their hundreds marched out demanding an end to the lockdown, adding that they would prefer to go outdoors and die rather than be locked indoors. The women complained of hunger resulting from inability to earn a living or to shop at markets. The headquarters of the Corporate Affairs Commission in Abuja, Nigeria has been gutted by fire just few days after the office of the Accountant General of the Federation went up in flames. The Registrar General of the Commission, Alhaji Garba Abubakar, confirmed the incident to newsmen this Wednesday, adding that men of the Federal Fire Service were quickly mobilized to put out the flames as soon as the fire outbreak was noticed. On the foreign scene, the United Kingdom this Wednesday promised to test all residents and employees of nursing homes who have COVID-19 symptoms after official data showed the death toll from the pandemic was far higher when the elderly were involved. Britain's Health Minister Matt Hancock said testing is key in the battle against coronavirus, and the government will ensure that everyone in social care who needs to test is tested. The expansion is part of the government's drive to increase testing to 100,000 per day by the end of the month. In a similar development, the United States Centers for Disease Control and Prevention, in its first national data, stated that between 10% and 20% of U.S. coronavirus cases are healthcare workers. According to last week's report by the CDC of more than 315,000 cases in the U.S., the data focused on about 49,000, of which 9,300 or 19% of them were medical professionals. That includes 27 who died. Dr. Ann Shushat, who is running the federal agency's response to the outbreak, noted that medical staff have also been hit hard in other countries, including Italy and Spain. And now to West Africa, where Ghana has launched an application for mobile phones that is intended to help the authorities track and identify suspected cases of coronavirus. The Ghanaian government said 100 suspected cases have already been identified using the app, as it is capable of tracking the movement of users via GPS and identifying persons who might have come into contact with a confirmed case. The app will also be used to monitor if individuals advised to self-isolate are complying. Ghana has conducted tests on 37,000 people so far and has 636 confirmed cases of the virus, including 8 deaths. Meanwhile, kids up to the age of 11 have returned to school in Denmark as the government relaxed the COVID-19 triggered restriction on education, making it the first nation in Europe to do so. Denmark was among the first countries in Europe to impose a lockdown, with schools closed on 12 March. Infection rates have been low, but experts warn that the strategy is risky. The International Criminal Police Organization this Tuesday announced that it uncovered a sophisticated COVID-19 face mask fraud scheme with the proceeds meant for a Nigerian account. Interpol, in a press statement explaining the scheme, said sometime in mid-March, German health authorities contracted 2 sales companies in Zurich and Hamburg to procure 15 million euros worth of face masks. The whole scheme started with an email address and website linked to a legitimate company in Spain selling face masks, according to the Interpol narration.
Coronavirus, they really make you do wetin you fit today, kampe. Now the cocoa thing where you owe yourself be that, because it's better to survive than for water to run your eyes. Oya waka boom boom begin the use hand sanitizers, facial mask, and not gree for body at all for anywhere, especially where people boku. Clear road, arrange yourself, keep social distance and practice good hygiene for house and surroundings. Do wetin government tell you, sit down for house and make it for no loss. Coronavirus dey, so make we gree together, waka fight am like a kozuna.
My appeal to Nigerians is that please, let's obey the social distancing. Let us obey the personal hygiene. Wash your hands. Don't go into congregation, and within 2 weeks, you go back and resume your normal life. If we don't do the right thing, we are going to face a disaster that we will not be able to handle.
This message now from the news agency of Nigeria, NAN. They can't pay.
Veteran Congolese musician Kasongo Wakanema, former band leader of orchestra Super Mazembe, has died. The musician, who has lived in Kenya for more than 30 years, is said to have collapsed and died at his home in the country's capital, Nairobi. Super Mazembe rose to fame in the late 1970s and maintained prominence throughout the 80s. The band is best known for hit songs like Shauri Yako, Kasongo and Nambi Makate. That's it on AD4 TV Radio News Update, coming to you live from Abuja, Nigeria's federal capital. You can join the conversation on our social media platforms at AD4 TV Radio on Facebook, Twitter, LinkedIn and Instagram. Please subscribe to our YouTube channel at AD4 TV Radio. Many thanks for watching. I am Merciful Ajinomo.